Hello, good evening, everyone. I am Dr. Harmeet Singh. I am Head of Emergency and Trauma at Fortis Healthcare, Gurgaon. Also, I am the founder and the chairman of World Emergency Care Academy and a part of Medical Crib. On behalf of World Emergency Care Academy, Medical Crib, and other organizers, I welcome you all on this prestigious series on toxicology. The objectives of today's presentation is Introduction to Toxicology series, Toxicology definition, and epidemiology of the toxicology. This toxicology series 1 is organized by World Emergency Care Academy, Medical Crib, Indian Medical Association South Delhi branch, and Lotus Diabetes Foundation. Let's talk about the schedule. This toxicology series is going to start from tomorrow, 26th of December 2022, and will end in the Feb month of 2023. This is the schedule. You can see that every day, every week, 9 p.m. the topics will be started there, and there are a lot of topics like Toxidrome is on 30th of December, which will be presented by Dr. Ajay Gupta, who is head of medicine at Max Healthcare Vaishali. Then on 4th of January, we have general approach to toxicology patients. On 11th, we have pesticide poisoning. And then accordingly, there are a lot of topics that we are going to send you on the WhatsApp group. The faculty of this series, you can see on the screen, Dr. Ajay Gupta, who is the head of medicine at Max Healthcare Vaishali. We have with us Dr. Abhilash, who is the head of emergency and trauma at CMC Vellore. Dr. Ritu Sabharwal, who is head of emergency and trauma at Kailash Hospital, Greater Noida. We have Dr. Malaya Mishra, who is head of emergency and trauma at Manipal Hospital, Jaipur. Dr. Prachi, who is head of emergency and trauma at Narayana Hospital, Gurugram. We have with us Dr. Ruchi Garg, who is head of emergency at Yashoda Hospital, Ghaziabad. We have with us Dr. Shali Jain, who is head of emergency at Mulchan Medcity, New Delhi. We have with us Dr. Neha Gupta, who is consultant of infectious disease at Fortis Healthcare, Gurgaon. We have with us Dr. Surbhi Chabra, who is head of emergency at Yatharth Hospital, Noida, and Dr. Kushagra Gupta, who is attending consultant emergency and trauma at Fortis Healthcare, Gurgaon. We welcome all the faculties on this toxicology series. This toxicology series is organized. The organizing team of this series is Dr. Harmeet Singh, myself, then Dr. Imtiaz, who is the head of emergency and trauma at Fortis Healthcare, Greater Noida. Dr. Nadeem, who is head of emergency at Fortis Healthcare, Vasant Kunj. Dr. Maninder Kaur, who is head of department and associate professor physiology at SRI Medical College, Meerut. Then we have Miss Nancy Ibrahim, who is the organizing secretary of this toxicology series. She is PhD scholar and educator at Max Hospital, Vaishali. Now, how to get the certification criteria. All the attendees have to attend all the presentations. They should have 100% attendance to attend all the presentations. which the schedule we have already discussed with you. At the end, there will be a exam, which will be question answer based, and then certificate will be issued. Now coming to the toxicology. Toxicology is the scientific study of adverse effect that occurs in living organisms due to any chemicals. It involves observing and reporting symptoms that arise following exposure to toxic substances. Toxic substance can be in the form of drugs, alcohol, pesticides, or other substances. Toxicology can be of clinical or medical toxicology. It is also forensic toxicology. There is analytic toxicology, environmental toxicology, general toxicology, genetic toxicology, regulatory toxicology, and veterinary and industrial toxicology. But here in this series, we are going to talk only about medical and clinical toxicology. Toxicology can be acute and chronic. What is acute? In which adverse effect occurs within a short period after exposure to the toxin. And chronic toxicology, in it, adverse effect occurs after prolonged exposure to the toxins. Now, what is the pattern of poisoning and snake bite? In 2015, there was a study done in India which showed that which are the cases that usually come to the emergency department. The most common cases that were encountered to the emergency were alcohol intoxication, which was 29.3%, followed by OP poisoning, followed by drug overdose, then phenyl poisoning, zinc poisoning, and simultaneously you can see the list is on the slides. Another study was done a year later to see what is the age group usually which comes to the emergency with these toxicologic issues. In this research, it was found that 72% people who committed suicide or consumed toxic agents were young age people. The age was less than 35, 72%. In 23%, the age group was between 36 to 55%. And in 5%, it was more than 56%. Total cases that were analyzed in this study were 1,373. Also in this study, it was checked that who were the victims. So it was found that 21% victims were homemakers, 11% were laborers, then again 11% were agriculture workers, and 7% were industrial workers. Most suicides because of drug abuse or addiction between the year 2010 and 2015. This is the data which is state-wise in India. So you can see on the screen that most common, the majority of suicides due to the drug abuse or addiction were from the Maharashtra, followed by Madhya Pradesh, then Tamil Nadu, Kerala, and then at the end Chhattisgarh. If we see this state-wise prevalence of opioid use consumption in India, you can see in North India, 2.8% consumption of opioid was in Punjab, followed by Delhi, which was 2.3%, and the third place was given to Himachal Pradesh, which was 1.7%. But overall, if you see in India, Mizoram was the highest, which was 6.9. So this is the statistics of suicide in India, overall data. Again, this is a state-wise, depending upon the percentage, the number of cases. And in this list, the highest number is in Maharashtra. Second number was Tamil Nadu, which was 11.8%, followed by West Bengal, 10.9%. And you can see in the screen, then Karnataka, Madhya Pradesh, Telangana, Kerala, Gujarat, Chhattisgarh, Andhra Pradesh, and Rajasthan, depending upon the number of cases of suicides by consumption of different kinds of toxic agents. Now, let's see about the mortality due to the drug abuse. This is the growing concern and major matter of concern. The highest number in 2018, you can see the data is of 3 years between 2016 to 2018. But let us talk about the 2018 recent data. The highest number was in Rajasthan, followed by Karnataka, then Uttar Pradesh, then Punjab, and then other states. This is growing concern because the number of suicide cases, the number of mortality due to the drug abuse or consumption of any drug, any toxic agent is increasing year by year, which is great matter of concern in India. In 2020, we had a pandemic of COVID-19. Thousands of people died due to the COVID. But if you see the data, India lost more due to the suicide than COVID in 2020. And we are not aware about it. We don't know about it. But if you see the data, into 2020, 1,53,052 people died because of suicides of different reasons. So India's growing suicide burden is there. And if we compare the data in 1990 till 2016, you can see the ratio between male and female. It is increasing. All our last 25 years of record, we can see female suicide deaths has increased from 25.3 to 36.6, and male ratio also has increased from 18.7 to 24.3. It's a great matter of concern, and nobody knows about it. People are not aware. That is the reason we are here with this toxicology series. India's share of world population, you can see overall in the world, India contributes 17.8, about 18% of total suicides which occur in world. This is also a big concern. India's suicide rates exceeds the global average, and this is not good news for us. Everyone has to be aware about this toxic agents consumed by the young people in India, and which ultimately majority of time lead into the death. Again, the big concern is student suicide, which goes up year over year. You can see from 2016 to 2020, the number of cases of suicides by students is increasing. In 2016, it was only 9,748, and in 2020, it was more than 16,000, which is also a big concern. And the leading state in this is also again the Maharashtra, followed by Tamil Nadu, then MP. 37% women committed suicide in world are Indian. So India is a big contributor to the world in case of suicides, deaths. And the majority of deaths that occur by these suicides are due to the toxic agent, consumption of toxic agents, which I have mentioned in my previous slides. Top reason for suicide. There are a lot of reasons, lot of issues, but the major three were family problems, illness, and other causes, including depression, stress, etc. etc. We know that in COVID, in pandemic, the death rate due to the suicide has increased tremendously. It is because of unemployment, stress, depression, and other reasons. If we see in US, the most common methods of suicide, the first number is firearm use, which is 51%. 28% is because of suffocation, including hanging, and 14% was poisoning, including drug of abuse, alcohol, and prescription drugs. So 14% is also a big number. It's not a small number. So the biggest killer, if you see in the slide, the biggest killer is the suicide. The top 5 causes of death in age group between 15 to 29, young age. This is the data from 2010 to 2013, was suicide, followed by unintentional injuries like accident, followed by unintentional injuries like others, then CVS disease and digestive disease. But the leading cause was suicide. And in suicide, we all know that the major method is toxic agent, consumption of drugs and other toxic agents. So, guys, you have seen the tremendous data which shows us that the toxicology is very, very important. Why it is important? Because every year a lot of deaths occur due to the misconsumption of toxic agents. These toxic agents are readily available in the market and people use it, sometimes overdose it, which ultimately leads to the death, which is the major concern. That's why, after knowing all this data, knowledge about toxicology to recognize and manage it on time in the emergency departments is very, very important. That is the reason where World Emergency Care Academy and Medical Crib and IMA and Lotus Foundation, we together tried our best so that this message should be given to the all the doctors, all the paramedics, all the medical authorities, so that attention should be given on this to save the precious lives. If you have any questions, please drop your question in the WhatsApp group that is created by Miss NC. And you can also email us on the following harmeetrai07@gmail.com, and we will try our best to answer your queries and questions. To summarize this presentation, it's very important that to know that high suicide rate in India is the matter of concern. Drug abuse in India is a big burden, and the student incidences of drug abuse is the matter of concern. Death rate due to misuse of toxic agent is increasing year over year, which is also a matter of concern, which we together need to discuss and spread this message to everywhere. At the end, before I close, I would request you all please subscribe our channels for other topics other discussions also, and for new updates. So please subscribe World Emergency Care Academy and Medical Crib. Thank you so much joining us and be with us. And please just follow the schedule that I have just shared with you, so that you can attend all the presentations, because we have a very prestigious faculties who are going to present a lot of topics, very interesting topics, very interesting discussions. Thank you so much, guys. Thank you.